On the shoulders of giants. We are in role model heaven, accompanied by Dr. David Ross in our last segment, and now his daughter, Dr. Rebekkah Ross, who will discuss her career as a physician and medical consultant at Tatum Family Health Center in Gary, Indiana. I'm going to kick to my brother for first inquiries.
This is amazing. The wonders never cease to amaze me about your family and what you're really contributing in sort of the innovative way you're doing things. And as such, I understand you are a medical doctor, you're an MD. However, you're choosing not to practice right now. Basically, you're a consultant for the firm. Okay, right. Consultant, kind of break that down for us. What's that about?
Well, the field of medicine really is a great field. It allows you to do so many different things with that. And for me, right now in my life, I'm focusing more on the business aspect of medicine. Seeing patients is great, but right now I'm taking a little hiatus from that, and I'm a consultant at the Tatum Family Health Center, which is a family business. And
see, I find that amazing. Excuse me for interrupting.
That's okay.
That's totally amazing because that is what's necessary. That's a very necessary job. Right. And you guys have the luxury of having family members, so you can assign roles, and you can shine where you shine, and Rachel shines where she shines. Your brother, your dad, you can all do what you do best, and that's fascinating. You know, I often make the analogy of a pride of lions. The way they have jobs, and they're each of them on their own are very strong and formidable predators, but as a group, they're almost invincible. Right. And that's kind of what I'm seeing here.
You know what, Rebekkah? I'm noticing here that you're the Corporate Operations Officer and Director of Marketing. What does that mean for Tatum? What does that mean?
Well, it means that I've come in from the outside. I'm a consultant, and I am looking at how the office works internally. I'm looking at all of the systems and making sure that each system that is in place already works like it's supposed to. And that also sometimes means creating new systems to allow the business and the company to work even better than it is right now. And I'm also the Director of Marketing because right now we have created a new part of Tatum Family Health Center, which is the Indiana Back Institute. And Dr. David Ross, who's the medical director, he is our new back specialist there. And
is this Dad?
That is Dad.
Okay, all right.
That is Dad, and I'm marketing the internal vertebral disc decompression
Let's
device.
get this straight then. The Indiana Back Institute.
That's correct.
In other words, your office is the Indiana Back Institute. Is this what we're saying right now? You founded it.
That's correct. We are the founders of the Indiana Back Institute. And the official name is the Indiana Back Institute at Tatum Family Health Center.
Wow. How big of a problem is back pain?
Oh, back pain is probably the #1 complaint of medical that doctors get on a daily basis, and people lose significant amount of money every year. I think the figures are something like $25 million every year are lost because people suffer from low back pain. So it really is a problem. And then it's another problem because people don't know what to do about it.
Right.
A lot of people take medications like Tylenol and aspirin, and those medications have a lot of different horrible side effects. And if you take too many, then there are problems. And then the other alternative is surgery, which no one wants to be cut on. So this new system that we have allows you to take the other route. Yeah. And the better approach, actually.
Yeah, this is really interesting because, see, we're seeing a family of physicians along with the physicians that work at Tatum that aren't in the family. Yes. We're seeing an entire medical center that's doing research. You know?
That's impressive.
This is like Johns Hopkins in Gary, Indiana.
The Indiana Back Institute.
This is big.
It's large.
This is big.
Absolutely.
And I think it's in terms of forward thinking. I mean, the fact that Tatum has, a COO and a director of marketing. I mean, I think that's big because, for one, it makes everyone more efficient.
Absolutely.
Keeps cash flows in order.
Absolutely.
And everyone knows their task and they can stay on it.
Right.
You keep them on it.
I do. I try to anyway. And sometimes, families, we all have our little internal struggles. But at the end of the day, we are kind of like the lion family, and we come together as a bigger, stronger force because we're all there working together.
Right, and they picked the right one for a consultant.
And it comes through, you know, with our patients. We try and just give them the best care as possible.
Right, because I notice how you deal with your sister Rachel, and it's how would you put it? Almost therapeutic. Yeah. She knows how to make Rachel feel comfortable,
right,
and knows how to chide Rachel when she needs to. I check your vibration out, and it's real positive, and that's what she brings to the table. Right. That's why, you know, I brought Yoda to the table today, because, you know, my man Yoda is all about that vibration. Yeah. And that's what I'm feeling here.
Absolutely. You know, you're a graduate of Butler University in Indianapolis. You went to Meharry Medical College, same school your siblings went to, same school.
That's right.
You know, your dad went to.
We are a Meharry family.
Meharry. We got to get out the alumni gear here.
You know, what's the song?
That's right. And I also noticed something. Now, speaking, I'm glad my brother, you're always doing the big picture thing here. I'm glad you took it there, because when you brought up lions, I thought of Africa. And when I think of Africa, I think of Rebekkah's resume.
Okay.
And when I see Rebekkah's resume, I see that this woman studied the mating habits of African elephants. Talk to us about that.
There's a problem in this country. We have a lot of zoos and a lot of facilities for animals, and the problem that they encounter is, especially with African elephants, is that they cannot successfully mate them in captivity, which that will eventually mean decreasing numbers of African elephants and extinction.
What, they don't have any Marvin Gaye albums? What's up?
Maybe that's what they need.
Sam Cooke.
Maybe that's what they need. So when I was an undergrad at Butler, I was given this great opportunity to go and study the mating habits and some of their mating behaviors that they encounter around the time when they're on their menses, I guess you could call it,
right,
and things like that. So it was really an experience.
So you got the chance to go to Ndola, Zambia.
Right.
Did you enjoy that?
Ndola was really an experience. I went to Zambia studying AIDS and the epidemic there. And I can't say that I enjoyed it. It was really an eye-opening experience. It was very sad. And that was in 1996. And the statistics today have just even further decreased. Like, I think now it's 1 in every 3 people in Zambia has the AIDS virus. And it's really sad.
That is sad.
Yeah, you know, the reason why I pointed that out was because, once again, your family is about research. I think that's beautiful, you know. And as I trickle down here, you know, I saw the sickle cell note there. And
right.
Do you feel comfortable sharing that with our audience?
I do. I have no trouble talking about the fact that I have sickle cell anemia, and I grew up with it. It's a congenital blood disorder.
Right. I have the trait myself.
Do you?
Yes. It
mostly affects African American individuals, and you get pain crises with sickle cell. And, you know, I've grown up with that, and it's just kind of part of my life now that you deal with and you work with.
How do you manage it?
On a daily basis, I try and take good care of myself. I get lots of rest. I drink plenty of fluids. I try and stay out of the cold weather. I don't exert myself too much, or don't get too stressed out, because those are all things that will precipitate a crisis. So
yes.
I just, you know, on a daily basis, I try to do that. But I think the biggest thing is family support. And I know that may sound strange, but with sickle cell, anything can set it off and send you into a crisis. But if you have that family support and everybody is always encouraging you and is sticking by you, it really kind of makes it better. And I think that's why I've done so well with it, is because I have that background. So,
when you have family, positivity, you got encouragement around you, it does help.
It does.
You know, and,
it really
and just
does.
the reduction of stress,
right,
you know, can help to ward off certain ailments.
Right.
You know. In a nutshell, can you just briefly explain to our audience, what is a consultant? Now, I know that's a big word, but in your particular field, what is a consultant?
In my field, a consultant is someone who comes in from the outside and looks at everything that's going on. For instance, I have a background in the medical field, so I'm able to come in to Tatum Family Health Center and look and see, well, are we coding and billing the insurances properly? Are we doing all we can for our patients. Do patients have to wait in the waiting room for too long? It's looking at the entire system and trying to bring it back together and make it better.
The big picture.
The big picture.
You see, you're on the right show.
Absolutely.
Yeah.
Big picture of the operation.
Yeah.
How about that?
This is huge. I mean, you know, I'm really fascinated by your family, and when you mention family support, it's the same with us. I mean, you know, for God's sake, you know, my co-host and partner in rhyme here is my brother. You know, this is my biological brother here. You know, our other brother lives in Arizona, and we support him as well, you know, in his endeavors as an accountant and as a musician, you know. And so it's good to see other people in other families who are supporting their families, because you know we live in the world of dysfunction now.
Yes.
You know, and what do children cling to most? Stability.
That's right.
Mama, Daddy, what time are we going to eat? Is it 6 every night, or is it 3, 6, 8? They look for stability, and when you've got family around you that are rallying around you, it makes life a little easier.
It really does, and it's funny that you mentioned that. What time do we eat? I mean, that's how my family was. We were clockwork growing up. I mean, my mother, she had us up at a certain time every day. We were at breakfast at this time. You know, everybody takes turns getting their hair combed in the morning. It was amazing how she, you know, worked that whole system out. And once you're on a schedule, and I think people really don't realize that if you put your children on a schedule, even though they might not appreciate it and they might not want to go to bed or might not want to do those things, it really does bring a foundation and some stability.
It does.
It really makes a difference.
Right, right. Let's give a shout out to your siblings. Could you just name them right quick here? Just name them.
Okay, there's Dr. Rachel Ross. She's a year older than I am. There is Dr. Nathaniel Ross, Dr. Ruth Ross, Mildred, there's David Ross, there's Tony Ross, there's Lynette Ross, and I hope I didn't forget anybody.
There's 8 altogether, right?
There's 9
There's
of us.
9.
There's 9 of us.
And you're the baby of the family.
Yes.
Makes 2 of us.
Did I forget Michael?
See?
Michael, yes.
I'm sorry.
Sorry, Mike. We almost forgot Mike.
Sorry.
2 babies of the family here. Cool.
2 words, closing comments.
I'm totally impressed. You know, live long and prosper.
Well, thank you.
Thank you for being on The Big Picture.
It was my
We
pleasure.
appreciate it. I'm going to get down to Tatum. I encourage all of you in the Big Picture audience, get to Tatum Health Center in Gary, Indiana, and all of you have a wonderful evening.